So I want to get into some specifics here. I want to
Yeah.
I want to talk about the difference with males and females, and I also want to talk about difference in ages. So of course, a child versus a teenager versus a adult could have different hormones going on at the time. And so I also want to talk about, I know people are probably thinking sex drive. I
Yeah.
think that people are probably wondering, I want to make sure we address that too. So I don't know where you want to begin, but let's go into some like specifics here when it comes to brain injury and hormones
hmm
and what can potentially happen in these different circumstances.
There are a lot of obviously variables. I think the easiest one might be age to talk about because
Okay.
there is a difference definitely in age, and it's easier as it is with a lot of other things to treat people who are younger. But that also sort of talks about the power of hormones. When you have um, endured a traumatic brain injury, let's say at 16, that you have a lot of production of estrogen and testosterone and progesterone and everything else, that you've got this reserve and you've got this large production of it. So you can sort of override a lot of the other problems or concerns. When you have a head injury at 60, it's just harder to heal. And, if you throw anything off in this chicken and egg scenario, it can be really hard to get everything back to where it needs to be. I think that's one of the reasons, unfortunately, with the military that, a lot of this underplayed and not really addressed as you're dealing with like young, healthy individuals. And so a lot of times I think that unfortunately the severity of it wasn't addressed as much as it should. So age plays a big factor because as we age, especially after 30 years of age, we drastically start to decrease our production of hormones. And those hormones are what help us to heal. So whether, that be progesterone, estrogen, or testosterone. The other interesting side note is that there's also a very healing hormone that isn't part of our hormone cascade called oxytocin. And oxytocin is greatly affected after brain injuries, trauma, and stress. And oxytocin is the hormone we make that's a connector. So it connects like you and I wanting to like communicate and engage as human beings. It greatly affects like your connection to your loved ones. Oxytocin, as women, we produce a ton of it after a pregnancy. And it is what makes us feel connected almost instantly to that baby and that child. And as people who go through head injuries know, you feel really disconnected, not only from
Yeah.
your body, but from other people.
That flat effect too of just like
Yeah.
not feeling any emotion. Like
Mm.
I would like not be able to cry even when I was sad. Like I felt like I didn't experience the full range of emotions for so long. And it was like I
Yeah.
felt like there was something wrong with me, or like I didn't care, but I knew I did care, but I didn't feel emotion the way that I I thought that I should be.
And one of the big reasons for that is oxytocin. And it's really sort of tricky because, as you probably have figured out from a lot of the things I've talked about, is there's a lot of chicken and eggs in this, and the fact that oxytocin is decreased, but then because it's decreased, it leads to feeling more disconnected. And so we actually can give oxytocin both nasally. You can do it in like a troche, which is like under the tongue. And then that actually will help to reconnect you and sort of bind you because as humans, one of the big parts of healing is community and feeling connected. And after a head injury, you become really disconnected. We see that disconnection in the hormones, but we also see it as a disconnection from each other. And your body sort of puts you into the survival mode. But in a survival mode, we tend to not really want to be around other people. And a big part of that is oxytocin. And so, one of the things that we can also do is give oxytocin to help be able to not only reconnect you to sort of your body and reconnect you to your loved ones, but also help the healing process because oxytocin is very healing.
Wow. I've never even heard this. So this is
So,
this is so helpful.
there's a lot of gems in the whole hormone world and a lot of things that
Yeah.
we can do. Another conversation we could have sometime is peptides. That's another great, which is a little bit different than hormones, but peptides, hormones, oxytocin, they're all things that we decrease in this whole communication of our body. And when that communication goes down and that's not right, then that's when we start to really feel like we're not able to make ground with our healing.
So brain injury basically causes a disturbance that kind of like stops your body from communicating with your brain the way that it should naturally when it's, not injured.
Yeah. It's an earthquake on the Richter scale of like 9,
Okay.
And so what has happened is you have then just shut down all the communication of that city.
Okay.
And so obviously, like right after the head injury, there's the emergency things that need to be done in order to make sure that there's not this, these leaks or problems or concerns that are going to seriously affect your city. But after that, what we have to do is then rebuild the city to be as good or even better than it was when that earthquake hit.
Okay. Wow. So, yeah, can you talk a little bit about the difference between like a male going through it versus a female? Because, I mean, I only really have knowledge of female, so maybe we should start there. But and then because I know just to be personal and real for you guys listening to this podcast, I always am willing to share my experience, but like my period got super irregular. So like it would be coming like maybe 3 weeks, 6 weeks. Like I never knew when it was going to come. It would always come, but just like really irregularly. And that was not an issue before the brain injury. I had already, it was like clockwork. I always knew when it was coming. And then every time I've had a re-injury, like, my period would start to regulate itself again. Then whenever I'd hit my head again, my period would get all over the place.
Well, so I think the easiest, simplest way to say this, and then we can elaborate, is that women are always going to be a little bit more complex. It's just the way that it is. But also, I think there's some beauty in that, in the sense of a lot of times as women, when we are really in tune to our bodies and when we really listen to them, I know it can be really frustrating because it's just like you said, it's like, okay, my period is off, but it's also a way for us to be zoned in on the fact that something's not right. Many times males will wait and ignore it, and then they'll come in with a testosterone of like 150 and they'll be 25 years of age. A testosterone level like in that age range should be like 800, 900. So they'll be like a fourth or fifth. They'll be very depleted. They'll be very, very, very depleted in the testosterone world, and they won't really know it until they've just hit rock bottom. So I always say, as women, I think that it really is like our cycles are so powerful. I mean, and when you really go in and you like dive into the history of like women's cycles and like how we used to deal with them, like back in the day or in different cultures, like we used to get women synced and we used to get women, put in these tents, and like they weren't put in the tents just to take them away from society. It was like they were put there for women's intuition. And because it was like a healing power of the whole tribe is to put these women together and to really listen to their cycles and listen to their bodies. And so with that being said, with us having such a superpower, really though, when our bodies do have a lot of stress and when our bodies are going through things, what we will see is that disruption. And so I think it's really important to listen to that when it's not right and use that as a guiding force.
But the thing is, so many doctors don't know that. I can't even tell you how many doctors my mom and I told my cycle's off. All they say is that can happen with a brain injury, and then they move on. So
and it'll fix itself.
It was just in a sense of like I just thought that like, oh well, when I have a brain injury, that just happens. I didn't actually have any knowledge to know like, oh, that actually means there's something going on in my hormones, which can be treated. So like, you don't have to just deal with it, or even if you bring it up to a doctor, like the doctor may not actually know because like Dr. Meaghan said in 2010, they were saying it's 1 year. So there's still so much that the medical community is still learning about brain injury.
And not to bash, anybody else or how other people practice, but so this is mind boggling to me. The story you just told, the number one thing that would happen, especially if you didn't go to a functional medicine provider and you went to somebody and said, my cycle's off. The number one thing they would say is, well, if it bothers you, let's put you on birth control. All birth control does is it gives you a regulated hormone to then disrupt that feedback system between your brain and your ovaries. And that's why there's so many side effects when we see women that have been on this for 10, 11, 12 years, is that what you're doing is you're shutting down the communication between your brain and your reproductive organs, and you're overriding it with a pharmaceutical intervention. There's, times and reasons for it. But at the end of the day, that this is our go-to solution instead of trying to bring back balance to the body is
Yeah.
mind-boggling to me.
They say like birth control regulates your period, but what you're saying is it actually shuts it down completely.
It shuts down that communication. And
Wow.
so it then takes over and it shuts down the communication for your brain to get feedback from what your ovaries are naturally doing, and then give them feedback onto what they should be doing.
So for someone healing from a brain injury, birth control is probably...
There's a time and place.
Okay.
So, and there is a time and place to possibly go on it. So there's a couple things, and I wouldn't definitely say that nobody should be on birth control.
You can never make generalizations like that. Yeah.
Yes. But I will say that I have had some individuals and some women that have found a lot of, especially at the beginning, some stability with birth control, and be able to regulate sort of not having these fluctuations, and be able to use it to help heal. And so that's wonderful and great. I think a perfect use for it. And I've seen that too, where some women that have been on birth control after head injuries have a hard time necessarily coming off of it without like a lot of irritability.
Okay.
And so it can bring balance, but I think that ultimately what it should be is a stepping stone.
Okay.
And to be used to help to really restore proper hormone function, because you're making steps in that direction. There's also some women who can go on it for a couple months and get that regulation, and then they can then come off of it and their brain and their ovaries will stay in sync. And so something like that,
Okay.
would be a proper use, in my opinion.
So brain injury, so in females, can affect that. Can we talk a little bit about males? I don't know much about it, but I know we're going to have guys listening to this that are like, okay, enough period talk,
Tell me how this affects me. So this is actually a little bit easier, in the sense of, with women, there's so many different factors, and there's, the monthly cycle and all of that. In males, ultimately, what we want to do is we want to make sure that there's a balance that has to do with both the hormones, and insulin actually plays a big role for both too. When you get into insulin resistance and things like that, which sometimes can happen after brain injuries or if there's metabolic challenges, that will actually cause a man to make more estrogen, and it'll cause a woman to make more testosterone. The reason I say that is because ultimately what we're trying to do with a male is decrease the inflammation enough to keep up his testosterone levels. But there's a lot that goes into that, in the sense of like looking at the full picture of things that can affect it after a brain injury. But the other thing that we see sometimes is that a man will come in with a low progesterone. So we can sometimes do that then through something called pregnenolone or progesterone to help just get their hormones, or DHEA is another precursor where we don't have to necessarily go into just testosterone therapies, because the other thing that you don't want to do is necessarily go and just give a bunch of hormones. You want to try to restore that proper balance. And so I think it's a good idea. Male hormones are easier to check. You can just find pretty good levels through the blood in males. With women, you are going to probably more want to go towards a urine or saliva. And that way too, you'll get a cortisol reading of a 4-point cortisol throughout the day. But males, the main goal is to continue to allow a production of testosterone, because testosterone is a very anabolic building hormone that can get their body into a healing state. And what we see a lot of times after a head injury is that we see a huge decrease in testosterone, which will decrease libido, decrease like vitality, feeling good, and it'll definitely decrease the body's ability to heal.
Thank you for all that information. So let's talk a little bit about sex drive, because I know people are probably going to have questions about that too.
So there's a lot of different things. I mean, first of all, and I do think, to be fair, sex drive is a little bit different for men, and it's a little bit different for females. Men especially, we find that if we can just get them out of a state of inflammation and into a state of rebuilding and keep their testosterone high, their sex drive usually will stay um, in an okay range. Obviously, there's a lot of other things that do play a role, but in a nutshell, with men, if we can just make sure their testosterone is okay, and make sure that there is no other underlying factors, problems, or concerns, that we can usually get a male's sex drive back faster than a female's.
And when you say get it back, meaning, just to clarify, brain injury can cause a decrease.
Yes. Yeah, and there's another factor too that I will say, because I've seen this a lot, and it affects men more, is that it does depend a lot on like where the brain injury has occurred. Like, for instance, if there is more inflammation in the thalamus, which is a part of the brain, it can actually change like erection and erection strength and things like that. So, there's individual components of that we do have to look at. And that's where it's important to sort of sit down with someone and see what's affecting their sex drive. If it is like desire, if it is function, and sort of what that individual has noticed, because we can be talking about sort of two different factors that play a role. Both, where was the main injury or the main inflammation, and thalamus is a big one that we see can change the function. Or is it that there are these underlying problems and concerns with the hormones that haven't been properly addressed, that leave that person to not then go into this component where they really are wanting to reproduce and have sexual function, because their body is just sort of screaming, I've got to get through this day-to-day life.
Yeah. And you said for women, it's a bit more complex.
Yeah.
Again.
Yeah. Well, and I will say for both genders, oxytocin is something that we can use that helps, that I think is underutilized. So for women, women just in nature are a lot more complex in the fact that there are factors that go in from, are they estrogen dominant? Are they progesterone deficient? Is there, again, a part of their brain that sustained a lot of the inflammation and injury that's leading to it? And also just, truthfully, in women, I think a lot of times when we are stressed, when we have more inflammation, we lose our desire, like our sex desire, a lot faster than men. And they say there's some primitive reasons for this. But, at the end of the day too, I think it is sort of looking at that big picture and how can we start to get that back. Progesterone can be helpful. Both men and women, testosterone can be helpful, because that is one of the driving forces for both of us. And then also the adrenals. I can't tell you. I mean, again, if your body's being signaled every day that you just have to survive, you're not going to thrive. And no matter the gender, sexual desire is something we file subconsciously under thriving.
Through your darkest night, hope survives.